Hello, and thank you for tuning in to the Ocala Eye Facebook Live Q&A. I am your host, Alyssa Jensen, and with me today is our panel of Ocala Eye's board-certified refractive surgeons, including Drs. Jank, Polack, Elhalis, and Vish.
Hey everybody.
Hi.
For this edition of our Facebook Live Q&A, you're going to learn more about LASIK, what to expect pre- and post-surgery, and have your questions answered from our LASIK panel. We have already received a bunch of great questions leading up to today's broadcast, so thank you to everybody that has submitted a question in advance. If you would like to submit a question at any time during the broadcast, please leave a comment and we will do our best to answer it. Now, you are all board-certified experts and collectively have more than 60 years of experience helping patients see better using state-of-the-art LASIK procedures. In the interest of time for you, our viewers, we're going to jump right into questions. If you would like to learn more about our panelists, please visit ocalaeye.com and see detailed information about their education as well as their experience. Time for questions. The first question we have is for Dr. Polack. The patient states that they're scared to have LASIK or PRK. Would you have the procedure done yourself?
So first of all, what I tell patients is if you're not nervous or scared about having the procedure, then that makes me nervous because it's perfectly natural to be afraid of having something done to your eyes. Having said that, I actually had the procedure myself about 20 years ago. At that time, the LASIK flap was performed with a laser. It was a very safe procedure. It's that much safer now because now the entire procedure is done with lasers. One important thing to realize is that the procedure of LASIK and PRK is even safer than wearing contact lenses. Some studies have shown that over your lifetime, the risk to your eyes from wearing contacts is higher than the risk of having a laser procedure. And ask any cornea specialist that has been doing LASIK and seeing patients wearing contact lenses, and in my 20-year career, I have never personally seen a single vision-threatening complication from LASIK, and yet I would say every couple of months I see a vision-threatening problem related to contact lens use. So it's important to put things into context. Yes, any procedure can have risks. In general, most of them are not serious. Obviously, you want to have it done in a reputable facility by a reputable surgeon, but the LASIK procedure today is extremely safe.
That's very great information. The next question is for Dr. Jank. Under what conditions is cataract surgery or refractive lens exchange with a multifocal a better option than LASIK?
Wow, we're really starting off with a bomb right there, but first of all, Dr. Polack's answer is, LASIK is an awesome procedure, except if you're over age 45. Now, if you're over age 45, a whole different set of variables comes into play, and mainly is A, is there a cataract? B, is it changing? And C, would you rather have a refractive lens exchange anyway? So before age 45, LASIK is your only option. But after age 45, if you have a cataract and it's changing, then cataract extraction may be the answer, depending on whether you qualify for cataract surgery. On the other hand, also, refractive lens exchange is possible. In both those operations, we take out the lens and we put in a new lens, multifocal plus or minus astigmatism, as needed. And in that sense, although it's a more pricey procedure, you get a lot more for your money. Because with cataract surgery or refractive lens exchange, you get 5 things. You get your distance vision, which you would also get with LASIK. You get your intermediate vision, which may or may not come with LASIK. And you get your near vision, which definitely doesn't come with LASIK, but does come with the new lenses. And in addition to that, you get your cataract surgery done. And finally, your vision quits changing. Less than 1% of people with CE, cataract extraction, or RLE, refractive lens exchange, experience any change in their vision at all. If there is a change in vision, then, and if it is due to refractive things, then we can correct that. If it's due to something else, then we can correct that too, usually.
That's great information. The next question is for Dr. Elhalis. How will I know if I'm a good candidate for LASIK?
Yes, our main objective really is to make sure that you're, one, safe to have LASIK, that LASIK is going to give you a good outcome, vision-wise, meeting your requirements, and then making sure it's going to last a long time for you. And when you come in for your screening exam, part of what we do is we look at the contact lens prescription, your glasses prescription, make sure it's been the same for a few years and hasn't changed very much. We want to make sure that your eye is healthy, that you have a good healthy eye exam, and you don't have any medical conditions that preclude you from having LASIK. Also very important is because we're changing the shape of your cornea, we want to make sure that your cornea is strong enough, and that's really the main kind of aspect of having the screening exam. So if you meet all those criteria, then you're a good candidate.
Great, thank you. Dr. Vish, will LASIK get rid of my reading glasses?
Absolutely, LASIK can definitely get rid of reading glasses. There are a couple of ways how this is possible. One is in conjunction with something called corneal intacs, which is actually a slightly different procedure that can be performed at the same time and increases the depth of focus of an eye. The other way is something called monovision. Monovision is something we do quite commonly. Monovision basically entails treating one eye for distance vision and treating the other eye for near vision. And when this is done, patients can blend those two images and get the best of both. Of course, before we proceed with monovision, we always want to simulate what it's like for patients. So we simulate that. We let them go about their daily life for a few days and see if it meets all their needs. And if they come back happy and they're getting what they need without glasses, then we know exactly what to treat.
Great, thank you. The next question we have is for Dr. Polack. Is it true that LASIK may give me dry eyes?
Well, one thing to realize is that any time that you have eye surgery, whether it's LASIK, PRK, cataract surgery, you can have aggravation of dry eye. We find that a lot of patients that present to us for LASIK, one of the most common complaints they have is, I'm having trouble wearing my contact lenses. Well, what's the most common problem they have with contact lenses? It's dry eye. They don't necessarily say their eyes are dry, but they may say, I'm seeing blurry, they're not comfortable, I can't keep them in for very long. One reason that you're able to wear contact lenses for more than a few hours at a time is because your eye desensitizes. So that allows you to keep something foreign in your eye and not really feel it. And so patients can have significant dry eye and they don't feel like they're dry, they just feel discomfort. So we'll have them out of the contact lenses and they have the LASIK procedure. Again, anytime you have eye surgery, this can aggravate the dry eye. But studies have shown that in 95% of cases, the dry eye is just temporary, and only in about 5% of cases is this a persistent problem. So it's important for us to identify dry eye before the procedure and to optimize the eye before having the LASIK or PRK procedure in order to make that post-op period as little bumpiness as possible. And then again, most people in 95% of cases will return to their preoperative state, which may have been a mild dry eye to begin with. So we do important screening things before. It's very important to check for that before the procedure to ensure that we have a good post-operative outcome.
Great, thank you. Dr. Jank, can you please explain how LASIK works?
Well, LASIK basically works by changing the shape of the cornea. And both LASIK and PRK do the same thing. In LASIK, if this is your eye, we create a flap, then we do the laser reshaping of the inner cornea underneath the flap, then we lay the flap back down. So LASIK, that's how it works, basically, and it lasts a long time, and there's not much more to say.
Great, thank you. Dr. Elhalis, can you please tell me what my restrictions would be after LASIK surgery?
Yeah, so the goal, of course, is to make sure that you heal well, and part of that will, and most importantly, because we want to make sure the flap stays in a proper position after LASIK, is to make sure you don't rub your eyes. You'll have some eye protection that you'll wear to help you also when you're sleeping, to make sure you don't accidentally bump your eyes. You want to avoid any kind of dirty water, which includes pool, hot tub. You want to avoid eye makeup, anything that could potentially, again, compromise the flap. We'll ask you to kind of take it easy as far as exercise, no strenuous activity. Also make sure you're limiting your use of electronic devices so your eyes don't dry. And then, generally speaking, most people heal pretty well afterwards.
Great, thank you. Dr. Vish, will my insurance cover LASIK?
No, insurance doesn't cover LASIK, but there are several great options for paying for LASIK. We use two options here, including Care Credit and Wells Fargo. And with both of those, you can pay in monthly installments. There's no interest on those payments, so it can be made very affordable for the average patient. And also, I'm sure my other panelists here have experienced this as well, but a lot of patients talk about how much they're saving by having their LASIK done. The cost of contact lenses adds up. The average contact lens wearer is spending about $350 annually to pay for their contact lens supplies. Most of them have a backup set of glasses too, so really within a couple of years you're spending as much money as it would take to pay for your LASIK.
Thank you for that. Dr. Polack, Dr. Jank briefly discussed PRK earlier. Can you tell us the difference between LASIK and PRK?
So PRK is kind of the granddad of LASIK. It came as a result of a clever eye surgeon who saw that they were using what's called an excimer laser to etch computer circuits. So he thought, what if we use that to reshape the cornea? So another smart guy came up with a formula, and they figured out how much tissue do we need to remove to reshape the cornea depending on what your prescription is. So that was a very popular procedure, PRK. It stands for photorefractive keratectomy. The only downside was there was a fair amount of discomfort because the treatment is done on the surface. It causes an abrasion, and it can be pretty uncomfortable, or at least was pretty uncomfortable. So another clever surgeon in Greece figured out a way of making a protective flap and doing the correction underneath the protective flap. So this all but eliminated the discomfort and also resulted in faster visual recovery. Over the years, we discovered a lot about what causes the pain. It's related a lot to with the inflammation that's caused by the procedure. And so nowadays we have sort of a cocktail of treating patients after PRK, which has all but eliminated the discomfort after PRK. So in the olden days, people would say they have a pain of, on a scale of 1 to 10, of like 12. And nowadays it's on like a 1 or 2 at the worst. The visual recovery does take a little bit longer than the LASIK does. On the other hand, once the surface is healed, it's pretty bulletproof. So we will use the PRK procedure in patients who are going to be exposed to potential eye injuries like corrections, law enforcement, martial arts, things like that. So both of them have advantages. In the rare cases where we do LASIK in one eye and PRK in the other eye, at a year, the patient can't even tell the difference between the two eyes.
It's very interesting. Dr. Jank, our patients would like to know, how long will my LASIK surgery last?
Well, basically, LASIK lasts forever. The changes last forever. And your vision will last forever until you have to have cataract surgery. So if you're young, the ideal patient for LASIK is, in their mid-20s, whose refraction is stable and has LASIK for that amount of refractive instability. But later in their 40s, 50s, 60s, and 70s, they develop a cataract. And when that happens, cataract surgery has to be done on top of the LASIK and accounted for by the LASIK. So here at Ocala Eye, we're very experienced at that. And all the surgeons on this panel are very experienced at that. And I'm a surgeon, even though I'm not wearing scrubs. I am wearing Stars and Stripes socks today, though, because it is fancy sock day. But anyway, so during the surgery, special measurements are made to account for the fact that LASIK has been done. If you go to a practice that isn't experienced in doing cataract surgery on patients who have had previous LASIK, then your odds of getting the implant focusing power correct are about 50-50, which is not that great. Here at Ocala Eye, we're 90% plus, which is the best that can be achieved in the world. And the way we get around LASIK issues created with, a virgin eye that's having cataract surgery is pretty easy. It's based on preoperative measurements. But for an eye that's had LASIK, we do some additional measurements inside the eye after the cataract is out of the way, and that helps us refine the focusing power such that 90% of the time we're going to get it right as far as your refractive requirements are needed. If you have a small amount of refractive or focusing area after that procedure, then we all have a big refractive toolbox that we can apply at no charge to make your vision to be the way you want.
That's very great information. Thank you for that. Dr. Elhalis, how many patients have 20/20 vision or better after LASIK surgery?
So it's important to remember that really the main goal of LASIK is to make sure that you're really reducing your dependence on contact lenses and glasses. And in saying that, the majority of patients, about 98% plus, are 20/40 or better. A good portion of those patients are 20/25 and 20/20. But again, our goal really here is to make you 20 happy. Everybody has different requirements as far as what they want their vision to be after LASIK, whether it's to have great distance vision. Some folks really want to just have good up-close vision, and we'll make sure that with your screening exam and with the treatment that you really achieve the results that you're looking for.
Great, thank you. Our last question is for Dr. Vish. What vision conditions can LASIK correct?
So LASIK can correct nearsightedness, farsightedness, astigmatism, and presbyopia with what we talked about before with the monovision. Of course, there are a lot of conditions that LASIK cannot correct, and it's important to get checked by someone that's qualified to distinguish what LASIK can be applied for appropriately. That's why it's important, if you're interested in LASIK, to call in and schedule a free consultation.
Thank you for that. We are just about out of time for this edition of our Facebook Live Q&A. If you've missed any part of today's broadcast, don't worry. We will archive this episode after, and it'll be available on our social media pages as well as our website, ocalaeye.com. We would like to thank our panel of Ocala Eye's board-certified refractive surgeons, Dr. Jank, Dr. Polack, Dr. Elhalis, and Dr. Vish.
Thank you, Alyssa.
Thank you.
Thank you.
Alyssa.
Thank you. And thank you all for watching. Be sure to ask about our LASIK winter special. Now through the end of the year, save $500 off of LASIK eye surgery for the months of November and December. And remember, you can book your free consultation online at our website, ocalaeye.com. Thank you, everybody, and have a good night.